Cervical cancer, a disease that silently threatens women worldwide. This video will delve into the intricacies of cervical cancer, exploring its causes, progression, diagnosis, treatment, and prevention, empowering you with the knowledge to protect yourself and your loved ones. The primary culprit behind cervical cancer is the human papillomavirus, or HPV. This common virus is transmitted through sexual contact. While most HPV infections clear up on their own, persistent infection with certain high-risk strains can cause abnormal changes in the cervical cells over time. Other risk factors that contribute to cervical cancer include smoking, a weakened immune system, multiple sexual partners, long-term use of oral contraceptives, and having given birth to many children. Cervical cancer develops over a period of years. Initially, HPV infection causes dysplasia, meaning abnormal cell growth in the cervix. These precancerous cells can be detected during routine screenings. If left untreated, these abnormal cells can progress to invasive cervical cancer. The cancer cells begin to penetrate deeper into the cervical tissue and eventually spread to nearby organs, such as the vagina, uterus, or even further through the lymphatic system and bloodstream. Globally, cervical cancer ranks as the fourth most common cancer in women, though incidence rates vary significantly depending on geographic location. It is more prevalent in developing countries, where access to screening and vaccination programs is limited. In developed nations, routine screenings like pap smears and HPV tests have greatly reduced the incidence and mortality rates from cervical cancer. In its early stages, cervical cancer often presents with no noticeable symptoms. As the cancer progresses, however, women may experience abnormal vaginal bleeding, such as bleeding between periods, after intercourse, or after menopause. Other symptoms may include pelvic pain, painful urination, and unusual vaginal discharge. It's crucial to consult a doctor if you experience any of these symptoms. Early detection is key to successful treatment. The primary screening tests for cervical cancer include the pap smear, which detects abnormal cells on the cervix, and the HPV test, which identifies the presence of high-risk HPV strains. If these tests reveal abnormalities, further investigation may be required, such as a colposcopy, where the cervix is examined under magnification, and a biopsy, where a small tissue sample is taken for analysis. Cervical cancer is staged from 0 to IV based on the size and spread of the cancer. Stage 0, also known as carcinoma in situ, indicates precancerous cells confined to the surface of the cervix. Stages I to IV describe progressively more advanced disease, with stage IV indicating that the cancer has spread to distant organs. The most common type of cervical cancer is squamous cell carcinoma, which arises from the cells lining the outer surface of the cervix. Adenocarcinoma, which develops from glandular cells in the cervix, is less common. Treatment options for cervical cancer depend on the stage of the cancer, the patient's overall health, and their desire to have children in the future. Treatment may include surgery to remove the cancerous tissue, radiation therapy to kill cancer cells, chemotherapy to destroy cancer cells throughout the body, or a combination of these approaches. For early-stage cancer, surgical options may include cone biopsy, loop electrosurgical excision procedure, or hysterectomy. More advanced cancers may require radical hysterectomy, which involves removing the uterus, cervix, and surrounding tissues. Targeted therapies and immunotherapies are also emerging as potential treatment options for advanced cervical cancer. Prevention is paramount in the fight against cervical cancer. The HPV vaccine is highly effective in preventing infection with the high-risk HPV strains that cause most cervical cancers. Vaccination is recommended for girls and boys starting at age 11 or 12. Regular cervical cancer screening, including pap smears and HPV tests, is also crucial for detecting precancerous changes early when they are most treatable. Practicing safe sex, avoiding smoking, and maintaining a healthy immune system can also reduce your risk. The prognosis for cervical cancer depends largely on the stage at which it is diagnosed. Early-stage cervical cancer has a very high cure rate. As the cancer progresses, the chances of successful treatment decrease. Recent research is focused on developing new and more effective treatments, including immunotherapies that harness the body's own immune system to fight cancer. Researchers are also working on improving screening methods to detect cervical cancer even earlier, leading to better outcomes for patients.